So this lady is saying that she is 29 years old and in the fourth month of her marriage, she has been experiencing vaginismus, which has made intercourse difficult and painful, often requiring her to stop due to pain. So she would like an explanation of available solutions to address this issue. So before I move on to Professor Chathurie, Dr. Probhodana, can you quickly explain to us what vaginismus is and what are the medical reasons that could cause this and the treatments available? And then we'll go to the psychological perspective.
Yeah, thank you, Chathurie. Sorry, Taruka. Now, the vaginismus is, when you say vaginismus, it's actually a medical condition. It's a kind of a really difficult disorder to treat. And now, when you say vaginismus, it's actually like when you even touch that area with even a cotton wool, it will start paining. But that's a medical disorder. But for majority of Sri Lankans, what we have is something called superficial dyspareunia, which is that at the start of the sexual activity or when somebody tries to enter, that is painful. Now, that is nothing to do with anything abnormal in my career from as a medical student up to now. I have only seen three, patients who had actually had a problem with the vagina. One didn't have a vagina. One had something called a very narrowing of the vagina, which is a congenital abnormality, and the other one has a large septum. So now, apart from that, I have, helped a lot of couples when it comes. This is a part of sexual dysfunction, which Chathurie will be also talking about it. So now there are like when it's now what she describes for me is what we call superficial dyspareunia, which is the commonest form of sexual dysfunction that we encounter in our practice, day-to-day practice, because of the way most of the Sri Lankans are brought up. Now things are changing, but in our schools there are no proper sex education, and if there's this problem is actually partly due to the man and woman both. So because the woman who has absolute no education sometimes, and then for majority of Sri Lankan women in the the now this era, which we all went through that, but the future will be slightly different, hopefully. But for majority of Sri Lankans, like having sex is like never going to school and somebody is giving you an A-level paper, because like they will, sometimes force marriage or whatever. They will, pre-marital sex is not, like it's a taboo, and there's no graded exposure, so they are married, and after that somebody will give her sometimes even a white sheet and then lock him in a room and go away. And that's one reason. And then for the partner or the husband, majority of them will learn sex by watching what we call porn movies, which is and which causes a lot of issues again, right? So there's a big and they also don't know. That's the main issue. So the whole, there is a big issue which like it's very difficult to, as I told you, each couple is very different, right? I can tell you a story where how I got involved in the what we call management of sexual dysfunction, or this part of it. When if it is really more like somebody if I had no sexual desire, like have big issues, then I'll be sending to Chathurie or somebody for more of a high end treatment. But most of the time it's just uh, you know uh, counseling and little bit of exercises, and believing in self will help. Now my main couple which I met, nobody has come near that. Like that is my trophy couple, because I met them in 2009. I just started my career, and then they have been married for 8 years, never had sex, and at that time they were going to divorce. But now they have three kids. The funny thing is, both of them being doctors, so they knew where to find help, how to get help, but they have not done anything. So this is very, very common, regardless your education level, whether you know it. It's about how to. So it's something like uh, a separate topic that we need to discuss there. But for majority of them, when it comes to fertility issues, that's maybe the issue. Okay. Yeah.
All right, thank you, Doctor.